Hi, everyone. Welcome to episode 334 of our TIG Bootcamp podcast. The title of today's interview is Leading Lyme, an interview with Dr. Kent Holtorf. Dr. Holtorf and his two brothers were all born with Lyme disease from their mother. Throughout their lives, they had terrible anxiety, fatigue, depression, and they kept being told by doctors they needed to sleep more, exercise more, or simply relax. Dr. Holtorf fought against the symptoms and went to medical school and became a doctor. Eventually, he was diagnosed with Lyme disease, Babesia, Bartonella, and a number of reactivated viruses and mold toxicity. As he discovered the treatment protocols that worked for him, he opened up centers to treat patients that were going through similar issues. Eventually, he formed Holtorf Medical Group, which is a world-renowned treatment center for Lyme disease, and many of our past podcast guests have treated there, like our good friend Danny Tiger. Today, Dr. Holtorf is training other doctors about the reality and severity of Lyme disease and other tick-borne illnesses. He's been featured on a wide variety of news platforms like CNBC, ABC, CNN, Extra, Discovery Health, The Today Show, ESPN, The Wall Street Journal, Los Angeles Times, US News and World Report, US Weekly, Forbes, Cosmopolitan, New York Daily News, and so many more. Dr. Holtorf is also the founder and director of the nonprofit National Academy of Hypothyroidism and Integrative Sciences. In his brilliant podcast episode, you're going to get a behind-the-scenes look at Dr. Holtorf, his transition into a Lyme-literate medical doctor that's world-renowned, helping many people in California, and exactly what he's doing today to help his patients. So without further ado, here's Dr. Holtorf in Leading Lyme.
Hello, Dr. Holtorf, and welcome to the Tick Bootcamp podcast.
Thank you. And as I mentioned, you guys have the best name out there. So that's awesome. You're doing great service. So I thank you.
Well, thank you. And I want to extend my thank yous to my good friend, our good friend, Daisy White, who's agreed to co-host with me again. So I guess I wasn't too bad last time, Daisy, because you agreed to come back and join me again.
Yes, I'm very excited to be in your midst again.
And not just Daisy anymore, Rich. This is going to be the first ever interview we've done with a special guest co-host and you and I with the brilliant Dr. Holtorf. So we are really excited tonight.
This
And
is
the first one with the special needs.
Yes, and I can attest to that because
That's what she says. I'm taking over your treatment. I'm like, okay.
I happen to be Dr. Ken Holtorf's patient advocate. I have the great privilege of that. And of course,
Double-edged sword.
It's a double-edged sword, yes. And I can state that many things, many podcasts, many interviews, many things out there about Kent as a doctor, Dr. Holtorf as a doctor, and the brilliance of what he's brought
Don't believe him.
to the Lyme community and to patients at large. Kent and I have collaborated immensely on multiple patients over the years.
Yeah, thanks for those wonderful celebrities.
Yes. Okay, so Kent and I have worked a lot together, but what I'd like to say and what I'd like to lead with and how I'd like to begin this is that I know him well as a patient, as a Lyme patient, and his journey is one that I think can be really helpful to many people. It's also extremely interesting. He's been through many, many incarnations of treatment. And I'm very excited to help the community understand Kent as Kent, the Lyme patient. And so this is my intent today, is to give voice.
No, it's weird. I don't have that wall that I can just start spewing
I'm
scientific
here
facts.
to help give voice to Kent, the human, the patient, the Lyme patient. And so I'd like to begin without further ado to ask about where you live.
Who's asking?
I'm
Are
asking.
you a cop?
I'm asking you where you
I
live.
live in Redondo Beach, California.
Okay. And have you always lived in Redondo Beach? Have you always lived in California?
I grew up in Huntington Beach,
Mhm.
and then went to Berkeley, then UCLA, and then to St. Louis for medical school. And the farthest east I'd been before that was Vegas.
Okay.
So I show up, I'm like, wait, what's this white crap? You know, are we supposed to go to school in this? You know, like, it's crazy. But yeah, it was interesting, a little different flavor out there.
So, but you grew up here and your family's from here and you were you were an only child, you had siblings?
No, two other brothers. Oldest brother, 6'4", full head of hair, good looking. Don't know what happened to me. Well, I do kind of know what happened to me. But football scholarship to Stanford, dated Heather Locklear, like just had everything going from, got accepted to UCLA Film School, but kind of never worked a day in his life. And he got drafted and then just kind of drug stuff, and then he passed away. And
I'm
then
sorry.
my middle brother,
And that was recent, right? He passed away recently, Not so
a
long.
couple years ago.
a couple
yeah.
years ago. Yeah.
And when we were talking about Lyme transmission and in utero, I know I had it my whole life. And like my mom, we just called her the sweating machine. Like she would just sweat like crazy. And she had a lot of addictive behaviors, but she didn't drink. And then my dad had chronic fatigue syndrome before there was chronic fatigue syndrome, and they're like, oh, you're lazy, I'll go exercise, that type of thing. And then my middle brother is just a hopeless mental illness, drug addiction. And I think that really affected. And my mom, when I was born, actually in Castro Valley, she was doing like Dexedrine to keep her weight down and smoking 5 packs a day. And surprise, surprise, I was born at 24 weeks. So I was either supposed to die or be retarded. So you can decide which one it is. And the Kennedy kid was in the hospital and he got the incubator. So I got the old being bagged for like 2 months, but it turned out the incubators gave them too much oxygen and they died. And I was just reading like studies on like if you don't have immediate skin to skin contact with the baby, like you lose like 30 IQ points. So I could have been almost normal. But yeah, she
She's
would
not self-deprecating at all.
and she had a daughter who died previously, so she just left the hospital because she didn't want to know of me if I wasn't going to come home. So I'm not mad at that. I mean, it's very understandable. But I thought people can ask me about my childhood. I'm like, I think it was normal, but maybe some of those things aren't quite normal.
Right. I mean, we don't know what's not normal because what's normal is what's normal for us when we're going through it until we can compare notes later.
And everyone's uncle didn't sleep with them?
No,
Oh,
that's
okay.
not a common thing. to be.
I was told.
So tell me, when you were living, I mean, obviously your mom went to pick you up after a few months and you did grow up in your family. So you did have a normal family life, right?
Mm-hmm.
And you're the youngest, obviously, of 3 boys. And how what were you aspiring to when you were a young boy or teenage boy? Did you always want to be a doctor?
Ever since I can remember.
Okay.
Which is kind of weird, but filling out the aptitude tests and like they do in high school, and it says what you should be. I should be an underwater welder. And I'm claustrophobic. I hate the water. It's like, okay. But no.
How does one come up with that?
I don't know. Just like for some reason you remember these weird things, and had a very good, basically high school experience, and the captain of the sophomore football team, academic athlete of the year, valedictorian, but then they took it away from me because my speech was a little condescending, I guess. And but my brother he stuttered, he was overweight, and which makes me, nothing against all the PE teachers and the teachers out there, but they would make fun of him and they would like bring me to the front of the line and just treated him like dirt, and I just resented it. And I think it's really, a lot of things have, but I think that was one of the things just killed his self-esteem. And he's
This is your eldest or your middle?
Middle. No, the eldest one in confidence like crazy.
Okay. So do you think that there was something about being your middle brother's younger brother that, propelled you to want to help and heal and take care of people? Was that something?
No, I didn't want to do anything. I didn't want to have anything to do with him. Like he gets
Okay.
arrested, but he's arrest proof because like he passed out on a bus and someone took his cell phone. And so he woke up and kept everyone getting off the bus. And the bus, they have like a button and the police immediately come. So they arrest him for holding hostages and stuff. And they're taking him in and he's so irritating. They pulled over and they said, get the hell out. Like, so
Okay.
it's like,
Okay, so that was not an impetus for you. So what is it that, gave you the inspiration, the aspiration, the
I kind of did a
dreams?
calculation, who would get the most chicks and drugs?
Okay.
But no, I'm kidding, but kind of, but no, it's just always something that's what my passion was. I love science and just kind of that's what I figured out to be. I don't know how much my parents influenced, but like my mom's had a lot of great advice. Like you're like, oh, this is hard. Well, then just quit. And so I would go against that, but my middle brother unfortunately took that advice all the time.
It's quite a dynamic. So, and also I remember you and I've talked about this. So your mom was like a very heavy smoker.
Yeah, they all had, both of them, like 5 packs a day.
And they were not necessarily well either.
No, again, my dad was sick and they had a baby who died, which, I don't blame them at all, but I'm sure it was from, the secondhand smoke, but probably also with the mattresses in those days, putting the kid on their back, but they lost a child, which is the worst thing that I think a parent can go through. And it totally changed them,
Sure.
And then they thought my middle brother was he looked just like her, was a reincarnation of Andrea. So she doted over him, anything go. I just stole $500 out of the register. If you don't come put in, I'm going to jail. She's, right down there. And I didn't know until after my mom died that we were Mormon, but my mom, after
How does that happen?
Yeah.
That's kind of an
And
interesting
after the daughter died, she said there is
dynamic.
no God. God wouldn't do that to anyone. And then my dad, who was atheist, turned to Christianity, to help him deal with it. So we grew up as Christian.
I do want to ask, did you learn anything about Lyme disease, tick-borne illness? Were you aware of these health issues that existed all around you? And it sounds like that you were born with Lyme and had congenital Lyme, or was any of this on your radar as a young child, even into your teenage years?
Yeah, I had no clue of Lyme. And in those days, we didn't have computers, we didn't have anything. And I just remember like in college and, basically going to the university library and finding the journals, getting the photocopy. And so it's really, information was a scarcity and a value. Now we get too much information and you got to filter through what's basically right or wrong. But what started happening like through high school, like one pupil is always bigger than the other. Like one half of my body be sweating, the other one freezing. My left arm would stop working for a while and, I couldn't find anything. So like, I know I had something and, Raynaud's like crazy. I couldn't shake hands. And then I also have kind of a theory of Babesia and drug addiction, like with my brothers, both of them. But that's why I really think that kind of in utero is much more prevalent than I think is felt, that is generally agreed upon.
And so I know that you started having these symptoms. Can you talk about how they started to progress to a point where they started to accelerate to a point where then somebody, there was a more acute version of what you were going through?
Yeah, and I don't know. I'm the most ADD person I've ever met. I have the worst memory of anyone I have ever met, unless it's
I would
a
agree.
medical study. Like I can quote medical studies, and I think it's more of a connection. But like I'd go to dinner with my girlfriend. She talked about it, I'm like, who are they? I mean, I'm scared to take one of the dementia tests, but I am better doing with peptides and like cerebral lysin and things like that. But yeah, it's always been bad. It's been a handicap because not remembering people, this is a big negative, and
Yeah.
you got over it. It's like, oh, hi, do I know you? Or I went to Berkeley. No, in high school, I went, my parents moved and I went to high school for one day. I said, I'm not going. They're like, yes, you are. I'm like, no, I'm not. So I was pretty stubborn. And I said, no, I'm going back down to my old high school. And they go, well, we're not giving you money. I'm like, okay. And, I basically just, live with families. And then we went to a reunion. I'm talking to this guy. I'm like, who are you? He's like, you live with me for a year. So I can't recognize faces so well. And my mom had that problem too. So I don't know how much it's genetic and that, but I need like kind of the devil wears Prada, like someone behind me, like this is so and so. Or we had our Christmas party and I'm talking about this guy, one of the employees. It's so great. He helps me with research. And they're like, and I'm like, what? No, he's awesome. It was the wrong guy, and so
Yeah.
I do a lot of generic, hey, how you doing? Instead of
So can you tell us a little bit about how your symptoms like progressed so that there was kind of a better understanding from doctors, or not understanding? I know your story, so I know there's some pretty dramatic things that occurred. Can you help us understand?
Yeah, so I was pretty good. I was functioning. I mean, weird things that would happen to me. Like in college, they called me the claw because my hand would stop working. I couldn't hold a glass. But I wouldn't do anything about it because I knew they would go in and say there's nothing we don't know. And then as I went into medical school, especially residency, I'm like, something's really wrong here. Like everything was overwhelming, just anxiety, couldn't sleep, night sweats, got, restless legs. And I, go to the university doctors like, oh, you're just stressed, take an antidepressant. I'm like, I'm not depressed. I can't function. And so I'm like, what am I going to do? And then for residency, I'm like, okay, what are my choices? Okay, wait, anesthesia, the patients are asleep. I don't have to talk to them, but I forgot the part about getting up early. And then, it was ingrained in medical school that anything alternative, integrative means no evidence, right? And was very evidence-based. I'm very evidence-based now. So that wasn't a consideration until I'm like, I can't live like this. I'm gonna, and so I snuck off, didn't tell anyone to, so-called integrative conferences. And I'm like, wait a minute, like, what a lie. These are more evidence-based than the stuff they're teaching me in residency, And so went on a program of like, like my testosterone level was normal, but the lowest 2.5%. My thyroid level, same thing. And high dose T3 was a savior for me. Some immune modulators and things like that, mitochondrial boosters. And I'm like, oh my God, I'm a new person. And I'm like, what am I doing in anesthesia? I hate it. And then went into family practice, took over a family practice that was all insurance, but we called it the thyroid optimization clinic, and no advertising. It just took off, and it was cash. We spend more time, we find, and then from there, once you start treating things like that, you find so many other things. And instead of doing the typical, whatever HMO doctor, and people like, oh, that's not my area, go over here. No, I'm going to find, read all the research and come back to that person and say, look, this is what I found. Let's try this. And
where were you in this process in terms of your health? Like you've optimized your thyroid, you're optimizing other people's thyroid,
Yeah.
but where are you in terms of your health? Are you in a better place?
And I was in Phoenix because I figured I got to have a backup to medicine. So we started a beer company, and we actually had a hangover-free beer. We had double-blind placebo-controlled studies, and we put it out. And then the Bureau of Academic Tobacco Firearms says you can't make a healthy beer, you know. And then we made a energy beer before there were any energy beers, and people were like, "Why would I want that?" You know, now everyone understands. We were at all the Circle K's, 7-Elevens. Like the Hard Rock, we did a little Super Bowl party with little naughty nurses running around with Dr. Holt's little beer company. But we had a bad business plan, so when we tried to scale up, it was contract brewers, and plus at that time people wouldn't pay more than $5 a six-pack. You know, now it's like $17 for a 4-pack, but and it costs us $7 to make. So we tried to make it up in volume, which didn't work. You know. And funnest industry ever, but I would see patients during the day and then go try to hawk beer at night, which is humbling. But we had no money either. So, so we ended up selling to Rock Bottom for a Rock Bottom price. But it was like getting an MBA.
I'm just curious. So you're making me think of Four Locos, because when I was a kid, and the biggest thing was to go out and drink Four Locos, and you'd get, the energy drink, you'd get the beer, right? And that was wildly popular, but it sounds like it was, you were ahead of your time in your market there.
Yeah, I think I was 5 years early. And plus I made it an IPA, which that's what I like, but it killed it because people are like, now it's like, the biggest growing style, but we should have.
So where are you in your health? I mean, you're burning the candle at both ends, which is tough on Lyme patients.
So was doing pretty well. And although it was more like a treatment for chronic fatigue syndrome, which I think is one of the worst things that they've ever done, because, you look at chronic fatigue syndrome, you have these symptoms, you got chronic fatigue syndrome. Oh, we can't do anything about it. We're not going to do any, test to see what it's from. Here's the antidepressant, get out of my office. Fibromyalgia, press out 11 out of 18 tender points. And there's nothing special about those tender points either. It's like, how do you just fibromyalgia? You got muscle pain and, brain fog and fatigue.
Yes,
okay, you got it. Like, and they have these rheumatology specialists, like with a dolometer or whatever, and it takes them 40 minutes to do an exam for fibromyalgia. Or people are like, I remember Richard saying, how do you know if they're better? I'm like, ask them, but we become much more sophisticated with like labs that we can, and our standard panel is about 40 tests to start with. And we can generally tell if someone has chronic fatigue syndrome, Lyme, and basically how severe they are, probably 70%-ish accuracy. Yeah, but.
So are you considering yourself at this point a chronic fatigue syndrome patient? How are you managing yourself as a patient? Because
I'm kind of a Sears patient now. And then.
No, but I mean at this stage of your development.
Talking about then?
Yeah.
Yeah, I figured chronic fatigue syndrome, because really Lyme was not even on the radar. And so it was chronic fatigue syndrome, fibromyalgia.
So you were really your own doctor? There was no other doctor working with you telling you what was going on?
Yeah.
At what point did Lyme become something that you understood?
Yeah. So what happened was then I went through a very stressful divorce. When I hired an attorney who says, oh, it doesn't have to be nasty, we'll make it mutual. She hires Gloria Allred for a consultant and fires her because they got in a fight. And then the woman on the cover of Power Woman magazine, and so it was a 5-year divorce that with a crazy person, and was so this is like stress. And we find that 3 things cause chronic illness in general. Maybe I'll put 4 in there. Stress is huge, and you'll see people death of a child, family member, could be an accident, another illness, often sets everything off. And it did a very big disservice to especially women who all of a sudden got chronic fatigue syndrome when they were stressed, like I say, a divorce. So doctors, oh yeah, you're just a stressed out woman, you know, and just discounted it. But so toxins, which were more selective back then, now everyone just bombarded with so many toxins, and you know, mold is a big thing.
We're going to talk about that. I want to talk about you then.
And so then I was fine, but all of a sudden I just got so overwhelmed with this divorce that huge symptoms, hit by a bus, bedbound, sweating, I couldn't sleep, terrible neuropathy. I ended up going into heart failure. My heart was fibrosed, which I now know is from high human transient growth factor beta, which is a big problem. And I couldn't stand up. It would take me hours to walk up the stairs. I mean, I could not function. Everything was overwhelming to me. Answering a phone, like, what are these people calling like at 3 p.m? What's wrong with them, you know? And then, so with the heart failure, I went to the cardiologist, and he did an echo. He goes, you got a lot of, like, your heart's fibrosed, it wouldn't fill enough. And he goes, maybe in 10 years, you get 10% better. So I'm like, I'm not going to live like this. I will, you know, I planned my suicide on Halloween for some reason, and then so I said, well, I'm either going to do it or let me try to fix it. So I kind of went around the world at 1 mile an hour, you know, bent over, running through the, you know, not running, but moving through the airport. I remember, and just going to different doctors, doing weird stuff, did a lot of weird treatments. A lot of things worked, you know.
So like, what are some of the treatments that you did?
Yeah, I mean, you know, plasmapheresis, which is obviously awesome, you know, ozone. We basically did the apheresis, and we took out the natural killer cells. And then I called this guy. So I read a study with Lyme that the dendritic cells are screwed up, and those are the cells are the most plentiful. White cells are very small, and they recognize the, you know, foreign thing, and they bring them back to the other white cells to tell them, hey, let's go kill this thing. And they're totally dysfunctional in cancer. I read that article. I'm like, that's interesting. And the same day, in a different journal, I happened to read the same thing goes on with Lyme. So I said, this is what I need. And so I called all, like, the Cancer Centers of America and places, and I'm like, can you do this? I'll bring you Lyme antigens. And you say, like, let me think about it. No, you know. And so, but I found a guy I knew through ILADS of the Lyme organization, and he did like Omar Morales at
Lyme, Mexico.
Lyme, Mexico. And I said, hey, you're doing natural killer cell function and apheresis. What if you take out my natural killer cells? I'll bring you Lyme antigens. Let's stimulate it and put it back. And he goes, I haven't done it before, but yeah, let's do it. And so we did it, and I felt great, you know. And then, but we tried to freeze it and then bring it back for treatment, and we it was just mush.
I remember, so Kent and I met 6 years ago.
Oh.
How long have we known each other? 7 years ago? Anyway, quite a long time ago.
Always like 3 months.
Yeah. And we met through a patient, because I brought a patient to work with you, and we worked, and so that's sort of how. But at the time that I met Kent, he was very much in the throes of his own treatment.
Just sweating.
And he had turned blue, like blue. And you called yourself a Smurf at the time.
Well, I didn't notice it. No one told me. I was doing high dose Argyria, no, not Argeria,
Uh,
Argentin, which I wrote a paper saying you can't get Argeria. And another one of the doctors in the office convinced me to do Gary Gordon's like silver. And within a week, I'm just blue.
He was blue,
And,
gray, blue.
and then I took Dapsone and got methylglobinaemia. And then I was just purple.
Yeah, I mean, it was worrisome, you know, we were all who knew him and who worked with him and who, you know, we would worry about him because, and that was before you went to Omar, before you did all that.
Yeah. And so I was basically saying, okay, that, hey, there's like the Horowitz style, who's awesome, contributed so much to new treatments. And he's more multi-system now, but just you need higher antibiotics, right? And so I was doing like 7, 8 antibiotics at 3 times a dose, 5 times a dose. I would never give that to a patient, but I'm like, I'm gonna kill this thing, or it's gonna kill me. And then I ended up in the hospital with sepsis, and I remember one of the nurses on the change, I could hear her, she goes, "Oh, this is that AIDS patient that keeps turning up negative for HIV like mad," you know. And then after I started, you know, kind of getting into the treatment and multi-system, I found out my natural killer cell function, which is the cell that basically kills intercellular infections, cancer, it was 0. So it wouldn't matter how much, because antibiotics don't kill everything, they knock it down to a certain point so the immune system can take over. And we find that is probably the best marker for downstream Th1 activity. And then, so what we've learned going ahead is that, you know, your body has, in a gross oversimplification, but you have to because it's the immune system, is like Th1, Treg, Th2, Th17. And so the Th1 gets stuff inside the cell, Th2 gets stuff outside the cell, Th17 is like the autoimmune antibody. And like when you get Lyme, it immediately secretes cytokines to suppress Th1, then it goes in the cell, usually within 48 hours. So this whole, oh, it has to be connected, you know, and then it suppresses that Th1, then it goes intracellular, now you got chronic Lyme. And also with just aging, and you kind of look at chronic Lyme, as accelerated aging. I mean, there's all the same components.
Right.
So with no Th1, that it doesn't matter. You're not going to be able, and also you have all this inflammation because it's like a teeter-totter. And so the body's trying to compensate and you just feel terrible.
Yeah.
And so we kind of we were a kind of hormone optimization and thyroid. Then we're the big antibiotic people. Now I would say, we do a lot of things. We still do all those things, but an immune modulatory clinic.
Right.
And we've gotten patients so much better. They often don't need antibiotics, or instead of the 5 years, 3 years and feeling horrible, oh, great, it means it's working, that maybe 3 months, 4 months. And I'll tell you my recent relapse. Yeah.
Right. So
we don't have to do it right now. But.
no. So essentially you're saying that you went through, you know, doing all of these heavy duty antibiotics. That was like that was sort of the beginning. I met you during that time. You were doing a lot of killing. Then you tried to work through doing more kind of immune enhancement with Omar, and Omar has a lot of very, you know, interesting tricks that way. Did you feel at that stage, did you feel that, okay, now I'm cured, now I'm not a Lyme patient anymore? Okay. So
I had good days. I make it to the office, but just feeling horrible and then sweating. And I did a media tour. It was like, you know, Fox News, Good Morning America, you know, CBS, you know, all those shows. And it was just like, I had to spray this stuff on my hair the night before to keep from sweating. And it's just like all aluminum. It just like, you burn it. And I'm like, oh my God, how much aluminum do they get from that? But it's a struggle. I mean,
Mhm.
life's hard as it is, but then when you add Lyme or especially Babesia, that, patients with Lyme will tell someone, oh, how bad it is. They don't know. And I found that people tend to lose empathy about 2 to 3 weeks. Okay, they'll give it to you, but then after a while, it's like, come on, here, go exercise, here, eat the better, and you're like, I want to kill you. And even my, wife started to do that, and I'm like, if you keep this up, I can't, I can't be with you just saying that, oh, just get out. Like, please don't say that one more time,
Right.
because you feel so bad to the bone,
Yeah.
And then I had, neuropathy, restless legs where I couldn't stand up, I couldn't sit down. I would just take like 20 showers a night trying to get some relief. Just the anxiety, you can't tolerate any stress. Brain fog, the muscle aches, it's just so multi-system.
So when you went past, doing the work with Omar, what was the pivot for you after that, where you're like, okay, so this worked to some extent, I have had some gains, maybe not so many gains.
Yeah.
What was the next step for
Yeah,
you?
a lot of treatments that didn't do anything, and some of them are good treatments, like for a number of people, but nothing works for everyone. And but so I went to Europe. I was just traveling around, just trying to find unique therapies. And I was in Belgium, and I found some peptides, and I took them, and I really didn't expect anything. And then, like 3 days later, I just walked up the damn stairs upright. Wait a minute, what did I do? And so kind of went back and said, oh my gosh, these peptides, started taking that. I'm like, I'm feeling good. But at that time we couldn't get them into the US, but shortly after that, we were able to. So we kind of became, known for peptides, but we do so many things like, from PTSD, neurodegenerative diseases, hypothyroidism, hormone optimization, but we're kind of known for that because we originally put out a line of injectable peptides, but the regulations were just crazy across state that we didn't want to risk that. But now we have a line of integrated peptides, which are supplements, and so.
So did you feel that peptides were kind of a cure and a solve for you? Was that the solve for you?
It changed my life. It saved my life.
Mhm.
Yeah.
Okay, so that was like that was the big step forward for you.
Yeah, I'm not saying I wasn't doing anything else,
Mhm.
And immune activation of coagulation. My blood was so thick, you could not take it out with like a 14 gauge, like trocar. I have to like try to stand on the desk to just get a CC out. And so really learned about the science behind that. And you look at so many people are hypercoagulable. Then you add, the vaccine to that, and COVID. It's a huge problem. And then, recently with the things, so curing that was great because I figured I'm gonna drop dead of a heart attack or a stroke here anytime. But and most doctors will put people on like Eliquis or these things. In fact, the other doctor in our office he had a totally occluded femoral artery, and they gave him 4 stents. They all clotted off like cement.
Wow.
And they told him that, well, Eliquis is better than heparin or Lovenox. And I'm like, no, it's not. And he said, it's interesting because I just had a patient who he put on Eliquis because all the research supposedly that they do says, oh, it's safer, it's better. And you see, put her on it and she just felt horrible. And obviously that didn't work for him. And we found it interesting on like the like a lot of Lyme chat groups, mast cell chat groups, that they're, especially the mast cell guys, are so smart, so nerdy, and I mean that in a good way, but they're so in the biochemistry, they miss the clinical picture. And so I'm saying, I'm doing, heparin for POTS, and they're like, no way, heparin is going to make it worse. I'm like, and then you kind of start, well, when we call the patients, I'm like, let's switch you to Lovenox at least. They're like, no, and heparin also is very antimicrobial and immune modulator, and I've never seen it stimulate mast cells.
Yeah. No, you've used heparin with a lot of our mutual patients. Now I just want to talk a little bit about this last, 8-9 months of your treatment, because I've been very much on board with it, so I can, contribute. For many years, as I was coming and working with you and seeing patients and stuff, you'd always say, I need to talk to you about my teeth, Daisy. I need to talk to you about my teeth.
Oh, yes.
And I was like, yeah, well, I need to get a panoramic x-ray, and
this was after 8 dentists, periodontists, oral surgeons, biologic dentists said nothing going on there. I'm like, I got swollen glands. I could just feel it. And then, so I'll let you tell.
Well, the other thing is that Kent has been on camera a lot. He's on camera a lot for peptide conferences and all kinds of interviews and all sorts of things, as a doctor who's well known in the community. And unfortunately, poor Kent, his teeth were kind of falling apart, breaking apart, and he had been gluing them back together himself.
So
super glue.
I went, how it all started was I went to a dentist referred by a patient who I thought as a recommendation, but she was getting paid,
Okay.
And so I go in and I just want to get some veneers, but he's just grinding. I'm like, do you say something? Do you say something? Like, I don't want to be rude. And then so he like leaves for a second. I pull my phone. I'm like, what the hell? He ground all my teeth down and did a whole crown, and they came out over 100 times. And I remember I was walking up to lecture at A4M and my 2 front teeth fell out. And it's just been a disaster. And I did the peptide summit where I interviewed like 50 doctors. And during the interview, my teeth fell out, but I said, let's roll. And we got so many great responses. Like, if he leaves that on, he's got to be telling the truth.
It's like, I had heart failure. I have no teeth.
Yeah.
So anyway, so after like multiple times, I just said, Kent, you've got to give me a panoramic x-ray. Like, I've got to have it vetted, So, I don't know, this is like a 2-3 year process. We keep talking about this.
Yeah, I'm not good at
He's
it.
very bad at follow through. And I'm like,
I'm do as I say, not as I do.
Go to this office and they're going to do a panoramic x-ray and they're going to send it to me. Okay. And let's, let me see, let me vet it. So I send it to Switzerland and it comes back and it's like, I'm like, okay, Kent, we have to go to Europe together. And so that was when our relationship kind of became a little bit more formal, as me being your health advocate and you being my client.
Well, I would have blown it off.
Oh yeah, he would have blown it up. But so, well, in my role, it's kind of hard to blow me off because I make all the goals and set all the goals,
for sure.
and, so kind of like the protocol police. And so anyway, so we went to Europe and we've been now twice, and we all got COVID. It was very fun.
I'm still mad because she goes, you got COVID. I go, no, it's not COVID.
No. He says to me post-op, something's wrong with me, Daisy. I need to take a lot of antibiotics, like, could you get me some more, like this one and this one and that one? And I look at him, he's like, I have a fever. And I'm like, Ken, I don't think you have an infection in your mouth. Like, no. He's like, oh yeah. I said, I think you have COVID.
I'm like,
oh, I don't have COVID.
And then we do the test and I'm like, damn it, false positive.
So he had COVID. But anyway, so Kent had this amazingly self-orchestrated dental plan. He had green glue. He had like, you know, like
Oh,
a
yeah,
very strange bone graft that had like it had like a staple and like some weird metal in it. I mean, we have this dream to make him and myself a case study through, you know,
Yeah, and
because
I
we both
think,
have like the worst dental cases.
and so, you know, we're doing that documentary. I don't know if we've talked about that,
I
but
haven't, no.
and what the hell was I getting at?
Your teeth, the case
Yeah,
study.
that, I think teeth are such an important part. I'm like, oh, teeth, whatever, blah, blah, blah. It's huge. And so many people, you know, they have their wisdom teeth pulled, they don't suture it, or get root canals, and it doesn't get all the bacteria out and just festers in there. And I thought, oh, you get an x-ray, you know. No, it doesn't show, or they don't look close enough. But when we looked at the x-rays that they looked at, when you looked at it, you're like, well, wait a minute, what's this here? What's this here? But
one of the amazing things about working with Swift Biohealth Clinic for me, as a patient advocate and as a patient as well, but as a patient advocate, is that there is so much, you know, collaboration. I'm in the surgery and I was in the
they
surgery,
listen to
and
you.
they do listen to me, and you know, we can look at things that it might be kind of in the balance and really kind of weigh them and use applied kinesiology to understand. And so we did a really, really thorough job. And it was an amazing journey. It was amazing for you, but it also provided some, you know, there was, unfortunately, dental work can kind of bring forth some latent symptoms, you know, some latent symptomology and
I felt great after 9-hour surgery.
Yes, and it's true, there's very little pain,
Just
but
digging
then
out butter out of my jaw.
but then there was a period where you had a little bit of a tough time, you know, and after that, in the interim.
Yeah, well, I think we know why now.
Because he went home to a mold.
Well, I think that set it off. So we were building a home and it's so far behind. So we sold our other house, good timing, we thought, and been living in hotels and Airbnbs, but they don't like allow you to do long term. So we had a suitcase and it's just stressing the heck out of me. So we went back the second time, and yeah, I'm like, I'm not feeling well, and then so she goes, we got to go get this innisphoresis. And I love plasmapheresis, but plasmapheresis, they basically separate out your blood from your plasma and they dump your plasma. So they got to give you back
Albumin.
Which now, you know, it seems to be, you know, cleaned a little better than blood, but our blood supply is totally contaminated.
So you clean the blood and then you give a dirty person's albumin back to the clean-blooded person.
Yeah. And
in America, this is how it's done.
And with this machine, it actually takes your plasma, puts it through, you know, specialized filters and gives it back to you. And the stuff that came out was, he's like, well, first I go there and he does a live cell analysis, and he's been doing this for a long time. He's actually retired, came back, and he stands up and like his clipboard drops. He goes, this is the worst blood I've seen in 43 years. I'm like,
call him Dracula because he takes everybody's blood and cleans it.
And I'm like,
Dr. Holtorf,
you know,
give us some more information on that. What how bad was your blood, right? Like, what was in it? Was he seeing other bacteria, viruses?
No,
you know, give us a little more meat on that bone.
Look at that. And actually, sending it.
He had severe Rouleau syndrome, where it was every cell was completely clumped together. There were no white blood cells. We couldn't see any white blood cells. And do we have the befores? We just have the after.
Yeah, that's like, that was in between.
And he basically looked like it was completely asphyxiated, like there was absolutely no,
I don't see how it was flowing.
there was, yeah, and it wasn't, by the way, one of the reasons, because Swiss Biohealth Clinic does have an inesphoresis machine, but they wouldn't do it because they had to do a groin catheter, and because Kent's veins, and even during his second surgery, we couldn't, and so when you do dental jawbone surgery at Swiss Biohealth Clinic, they use they draw a good amount of blood so that they can make this protein rich growth factor, which then they put into your bone as a stem cell, your own, and it looks like worms essentially. And you know, his we call them membranes, his membranes were so poor we could almost not use them. We had to draw his blood
You know,
3
that's
different times.
that's very hurtful.
I'm sorry, you had shitty membranes. And so
Well, that
essentially, you know, when he was asleep, we were like, this is not like a sign of optimal
Oh,
health.
you're talking
We're
crap
talking
about
crap
me when I'm
about you.
asleep.
So, I mean, when he came to, I was like, you know, Ken, I'm concerned about the quality of your blood. Like, I want to take you to do an aspheresis. So we
Yeah, I
went
said a lot of people stand in
to
line.
Alpstein, and yeah, and so, and Dracula was like, I've seen a lot of funny
Yeah,
guys, but
so-
you're the funniest.
So yeah, and then he says, oh, you gotta, you know, take it easy, da da da. And then I'm on my phone making all these calls. He goes, I'm glad to see that you're following my recommendations.
Yeah, he was like, you've got to
And
stop.
I didn't
being a
get the
doctor and be a
sarcasm. I'm
patient."
like, oh, thank you. Like, you know, but yeah, here's the before.
So you
That's
can
my
see
damn
like the
blood.
blood, like cells, just not, there's no
Wow.
separation of cells. They're like
I don't know. It's
completely.
like
Dr. Holtorf,
Kibble.
if you're comfortable, can you please email us those photos so we can attach them
Yeah.
to the
Yeah,
show
yeah.
notes, because
Look at
our
that.
listeners
There's
can't
like-
see the video.
Just all
It's
this
like
grime.
cauliflower, macaroni and cheese.
Yeah,
It's all
then-
just globbed
And that's
together.
actually the
That's
medical
wild.
term.
yeah. And then after 2 inesphoresis, and with a very interesting what was that? What we call intermission? Because Kent, and I can say this lovingly, Kent is not light-handed when it comes to his own care.
Oh,
Is
I do toxicity
he
studies
can-
on myself.
He
In
tends to,
fact, last night I had taken
You talked about
Dapsone
Dapsone.
before. And so I told my girlfriend, and I just happened to have, I got methylglobin turned blue, and I happened to have IV methylene blue in, you know, my house. So I just ran it. But so I told her, okay, I'm going to do this pill. Can you keep these in case I'm dying? She's like, oh, I got to go to bed. And I'm like, well, I'm glad your priorities are right.
she's just used to him.
And she goes, get a bell. I'm like, I won't be able to speak.
So the first trip, his girlfriend, Lori, who's this just wonderful, wonderful person who understands this journey herself, came with us. And so, and when we're flying there, she's like, tell me about this clinic, tell me where we're going, blah, blah, blah. And he's like, oh, I don't know.
See, I normally I'd research heck, but when Daisy's been to every expert in every country, and she's been there, and then she integrates that, you know, to her knowledge and her care. So I don't trust any doctor generally, but I trust you, you know.
So, you know, his girlfriend's like, how do you not researched this? You know, like, this is where we're going.
You
So
know, I'd be like, yeah.
second trip, she's like, well, honestly, Daisy, I don't think I need to go. You got this. And I'm like, yeah, you're right. I got this. So the second day we're supposed to go to inesphoresis. I get, you know, we're at the hotel, and I think I was on a different floor than you. But anyway, I get a text from Kent
Yeah, she
saying,
got the nice.
I'm not doing very well. I think, you know, I think you need to come see me. So I don't know. So, you know, the clinic lets me have like a
Oh,
catheter, have a
and-
line in patients so that I can
and-
manage their
And they'll
pain.
even bring her in for the aesthetic part and say, what do you think? And I remember, you know, I was like, oh, it's fine. And she said, no, you gotta shave this part
I
down.
mean, my job is to make sure that things are thorough and there's no stone left unturned, including the aesthetic of something. So, but anyways, so Kent is like, I don't know what I did. I gave myself a bunch of this and this and that, and this and this and that. And he's like shivering and vomiting, and he's got a fever. And I'm like,
That's
so-
normal.
maybe you have COVID again. So long story short, we don't know. We
got
don't
rid
know
of
what
it.
he did to himself, but
But when you look at this, it explains it. But so after 2 treatments, like full of white cells,
yeah,
like you can see
wide
the
open,
red
you
blood
know,
cells.
separation of
like
the red
here.
cell.
That is a wild transformation. We really need to get those photos when you put them in the show notes
Yeah.
because
Yeah,
we
yeah,
need,
yeah.
we
I
need people
have
to
them.
see how
That,
powerful
I
that is.
have it in the Dropbox, so I'll forward that to you.
Thank you.
But
Thank
the
you, Daisy.
scary thing is, I'm looking through it and I'm like, what the hell is that? There's a giant parasites all through in the red blood cells.
Right, you can see it. I mean, you can't see
Yeah,
because I
it's
don't
Oh,
have
wow. Yes.
video.
I mean, a
But-
ton. Usually you gotta like search and search and search, but
This
like,
has to
look at- like big thing sitting there. I'm
Yeah.
like, oh my God. It looks like Babesia to me, but we keep coming up negative. But
So those are parasites inside the cells? That's what we're
within
seeing,
the
right?
cell. Yeah.
Wow.
So this leads us to, now we're kind of in this place where we're doing a deeper dive on Ken's health because we learned a lot in the last 4
yeah,
months.
and it kind of happened when I got busy. I stopped doing all my treatments, stopped doing, just basic maintenance stuff, and stopped doing peptides that I would do, at least 3 times a week. And then you start feeling bad, so then you really don't do treatments. It's harder. And then it just hit me. I'm just like, I'm not feeling well. And I'm surprised I was able to.
Well, actually, I remember, and you can comment on this, but when you came back, you had some very tough days. You had some anxiety. You had some really severe anxiety. So you were pushed back into some old symptomology. And you've really been working through it. So it's been kind of a little bit of a relapse for you.
Yeah, no, it has. And so I was in denial for like a few months.
Mhm.
And then I'm like, I think it's come back, and I don't even think you ever get rid of it. I think you suppress it, kind of like Epstein-Barr and the herpes viruses. And I stopped doing what I should be doing. And
then the other bad habit that Ken has is that he stays up all night long and works and works and works and works and works and
we
works.
all slept for 2 days.
2 days, and so, and when and so part of my role with him as an advocate is like, look, Kent,
Because I'm so behind.
I get that you have this much to do, and I get that, you have to make an impact. Especially now, we need all to make a bigger impact with what's going on in the world. And I said, but you're not going to save time by using all the time. Like, you're gonna die, and so I've been kind of an intervention in his survival system, and reminding
Yeah,
him
I've
that
always been
he's
a
human and that he
nice
wants to
person,
be a
but
human being.
I don't know. I guess I'm very geeky, and like I'll start getting into research, which then leads to more research and go down the rabbit hole. And all of a sudden the light, the sun's coming up,
Yeah, and it's understandable because you're very passionate, and that, I guess, leads me to, look, you always wanted to be a doctor, you didn't necessarily want to be a doctor for the reasons that you are a doctor today. So it's interesting to me.
That was more of a joke.
No,
But,
but it is interesting because the progression of yourself as a human being in your career in relationship to your own health journey, like, how did that transform for you in terms of your contribution and in terms of who you are today?
oh, well,
Because-
I think and this is what I was in the back of my mind, I was like, I can't stand living like this, but I had this glimmer of hope that if this is going to help me at some point. And I would have been treating Lyme patients. I would have just kind of, oh yeah, they're just, nutso and stuff. I could have been very much the doctors that we hate, you know?
Well, you refer to yourself.
Thank God you're not, though, is what I have to say, because I just want to chime in. You both are being so humble right now. Dr. Holtorf, we've heard about you since we started Tick Boot Camp. In fact, one of our favorite people, Danny Tiger, has had radical transformations and is feeling so much better after treating at the Holtorf Medical Center. So, I mean, thank God. Unfortunately, you've had to go through this horrible journey, but now you're helping people get their lives back through your clinic. And it's really cool to see Daisy, who is one of our favorite guests we've ever had on the podcast and one of our most popular guests we've ever had on the podcast, be there to help you along in this journey as well. I mean, the two of you are such powerhouse individuals. And I think people are going to really love hearing this combination of you two together to keep you and your health in check, Dr. Holtorf, and keep people like Danny Tiger and others in the podcast in a proper path to healing and health. So I just wanted to interject and thank you both for everything you've done.
Awesome. She spoiled me. I don't want to see a patient without her. And like, she'll finish my sentences. And I think we should give, what do you think of this? Like, yes, that's what I was going to say, you know. So she's really great, knowledgeable, and able to, it's hard to keep me on track and do all the little things like, actually let people know what they're supposed to be taking, things like that.
I think Ken and I have worked really well together because I can write protocols from his methodology. I understand. I mean, I have, as an advocate, have been able to do that with a handful of doctors. And I have to say, I feel very fortunate that the doctors that I do work with, like Kent, really do trust me, really do know that I'm very savvy so that I can, support their vision. And so that's been wonderful, but it's also really been wonderful to be part of Kent's recovery journey for him, because he needs to be optimized in order for him to be able to do what he needs to do.
Because I push it. As soon as, so I started treatment like 7 days ago, I'm already feeling so much better. And what do? I stay up for 2 days.
He doesn't know, how not to be bankrupt in his own energy system. And it's habitual, and he's been doing that his whole life. So part of the rehabilitation for a patient like this is to teach them that they actually have to have a savings account of energy and to manage that. And then there's a haphazard quality to Kent's way of managing his own care, because he knows everything. Kent and I both, as patients, we have tried everything. There isn't anything we haven't tried ourselves that we haven't, like, if we're going to help people with anti-senescence therapy, then we're going to, go through anti-senescent therapy. And so ultimately, he could have a table full of a ton of crap and wake up in the morning and just like, I'm gonna take this, and that, and then say, you're feeling good today. What did you do? I don't know, and unfortunately, so many Lyme patients do this, where they, they've seen 10 doctors in the last 10 months, and they have protocol 1 through 10 on the counter, and they haven't even bought stuff on protocol 11 because they don't know what it is and they haven't researched it. And then there's no method to any of it. And then, there's a lack of rigor, there's a lack of consistency, and there's a lack of methodology. And even for someone who knows, because he's a doctor, on the front lines taking care of people, it's easy to let go of all of that.
Yeah, so, but it's also, you can see pain when you feel bad, and also when you feel good. I can take advantage of that, and so I'm going to stay up as long as I can. And hurts you in the long run. But it's like, I tell people exercise, eat well. Like, I'm passionate about exercise. I exercise every 4 months for 8 minutes, rain or shine. So I don't want to overtrain. I've seen people overtrain. I'm protecting against that.
So I know there's some like special questions that we ask, or maybe there's more things that you guys want to ask that you didn't ask. Or
I just want to mention one thing with the heart thing, because that was the thing I could not tolerate. And then so the cardiologist said maybe in 10 years you get 10% better with rigorous cardiac rehab. I'm like, no, I'm not. That's not good enough. And so I do all these peptides and treatments, and feel better in 6 months. And then in about a year, just over a year, I walk in the office upright and get an echo. And he's like, that's weird. I didn't think the fibrosis could reverse. Did he even ask me what I did? No, he didn't care. And I'm like, okay, thank you. But
Do you need to sign a release to say that you spontaneously healed and he
Oh, yeah.
doesn't want to?
They said, well, I don't believe in that. So you think it's a miracle instead.
Mhm.
Yeah.
But this is where I think it's so important, and we always express to people, you have to have hope, right? Because certain doctors may say you're going to be sick forever, you're never going to feel better. But I think we need to continue to have hope, because there is something out there that can help us. And the more hope we have and the more things we continue to do, the better we're going to feel. And overall, we're going to make gains in our health, right? And I just don't want to lose sight of, I mean, we are so appreciative, Dr. Holtorf, for all you do for the community. And we want to thank you for sharing your story, because it is really powerful, everything you've gone through and overcome in your journey, and now with the help of Daisy. But Rich is going to jump in after I finish his question, but I really want to focus on your clinic and how you're helping people as well at the end of this interview, because I mean, you really are changing lives and saving lives through the Holtorf Medical Clinic, and you're doing some really cool, powerful stuff and research with all kinds of different things. You talked about peptides, the endocrine system, hormones, et cetera. So if you could just quickly touch on that and how you're helping people now in the chronic illness community and the Lyme community.
Yeah. And, we started some, FDA trials as well to try to get this more mainstream. But it really found that medicine moves very slow. And we actually have a article on our nonprofit National Academy of Hypothyroidism, NA-hypothyroidism.org, but someone hacked all our sites, but we're fixing those. But it says, people would say, if this is so great, why doesn't my doctor know about it? And so it goes through, and it was even like LA Times and the papers, like doctors, Annals of Internal Medicine showed that most doctors are practicing 20 years behind what's available in medical research. Now, okay, they don't read medical research. They may read an abstract that a drug rep brings in, but they found the biggest reason for it takes on average 17 years for a proven new therapy to get accepted in mainstream medicine. And again, it takes 17 years unless there's it's a drug and has a sales force. And they found the biggest resistance was, if you give a doctor, here's 50 studies showing what you're doing isn't optimal, there's a better way to do it, they discount it. They go, oh, my patients are different, I don't like that study. But also, so I used to get very mad at the doctors, but they're in a system that doesn't allow them to do anything. Like for them, a Lyme patient is a nightmare because they got to keep a quota. They're bogging down their system. They're just getting frustrated. I think they said a doctor will interrupt the patient, like, hey, how you feeling? Within 10 seconds. But they're graded on how cost effective. And what does that mean? It means don't do any labs, don't make diagnoses, see patient every 15 minutes. And so they're in a system that, like, if they see any complex illness, they're going to turf them. And so you're going to get, you're going to go to a neurologist, or to go to a, cardiologist, a gastroenterologist, you're going to go, to all these different groups, but they're not going to put anything. They're going to do their little thing that they do. They're going to, do a colonoscopy and a scope, go, you're fine. They're, and you're just, you can't, they don't put it together, and it's all connected.
Art of referral.
So, Dr. Holtorf, I think there's two different lines that we should probably explore here together, just to give folks some insight into how to best work with their primary physician, right? Because most folks who are going to be dealing with Lyme disease are going to have to get the most out of the current medical system, and they're going to have to know how to work with a primary care physician. So what recommendations would you have for folks that would allow them to get the best outcome when they're working with someone who is working with an insurance system and only have 15 minutes to diagnose and treat the patient?
It's essentially an impossible task.
Yeah.
I tell people to stick with their doctor if they'll work with other doctors. But you can ask more time, they're usually not interested. But if a doctor says, I don't know, stick with them.
Mhm.
And we found the less a doctor knows, usually the more adamant they're right. And so unfortunately, this whole insurance model,
Mhm.
and it's so bureaucratic, and so much money goes, or you look at labs, like to go to Quest or LabCorp, if a patient has insurance, they don't cover it, they'll charge them $171 for a TSH. Now, if they go through our office and we bill it, we don't charge up any labs. It's $19, but I can get it now, I found out, for 75 cents. So how much do you think they're paying for that test that they're charging 175 for? Probably a nickel,
But I think it's also really important for people to educate themselves. Like, for example, my father-in-law who lives in Glen Cove, right? He has a lot of, he probably has Lyme disease. I've talked to him about this multiple times, and here his, daughter-in-law is a Lyme advocate. And yet, somebody did a Western blot on him. Obviously it was inconclusive. But like one of the things that's disturbing, he's diabetic, he's had all kinds of issues. It's like he's an elevated TSH. Nobody's done any further thyroid studies on this person who has metabolic disorder.
It's crazy. If a primary care sees a TSH of 10, they send them to endocrinologist. Just treat it,
Or we're talking about like a TSH of 5.5, they say that it's normal. You know what I mean?
Crazy.
So
the pituitary sees the most thyroid. If it wants more thyroid, you're not getting any. And I really have a big issue with pediatricians. And you look at obese children, they'll have a high TSH, but they go, oh, if you lose the weight, that will come down. And it does, part with the inflammation, but the kid's not going to lose weight with a low thyroid. And what's the chance of a obese kid going to be an obese adult? And then you got self-esteem issues and other problems. It's criminal.
These are the things that I think patients can educate themselves about. They don't necessarily need to go outside the box, and they can request. You can request a complete thyroid panel. End of story, and inform yourselves about just conventional labs within the system. What is it that's not being done? Ask for all of your results. Take them home, study them, understand what it is that you're getting and that you're not getting.
It's a daunting task.
It's a daunting task, but it's doable. And many people out there are smart and they don't have the education. One of my
and the doctor will just intimidate them and say, stop being Dr. Google.
Don't ask questions. But one of my passions is to educate the world at large and the community at large, not just Lyme patients, because Lyme patients are more savvy, typically way more savvy than the average patient. But nowadays everybody needs to be educated. We need to learn what we don't know so that we can be part of our own solutions, so that we can be part of a greater solution.
It's totally true, but most people, it's too overwhelming. And when I go to parties now, I have to bring lab slips because everyone's like, and so many people are sick. It's like, I'm sick, my sister's sick, my wife, and they're asking all these questions. And then they're like, well, my doctor says I don't have that. Well, how's that working for you? And I used to fill out a lab slip there, but I found the majority never followed through. So I don't do that anymore.
Yeah.
So, Dr. Holtorf, don't we really just have an acute care system at this point? As we move toward a managed care system, and I can tell you that I'm old enough to have been, a patient under the pre-managed care system, the Bill Clinton presidential administration. And the quality of care that I had received during the early part of my life was substantially different than the quality of care I've received since then. And I think that's because we made a policy decision, or at least elected officials made a policy decision, that what we were going to do is we were going to open up the system to a larger number of people, and we were going to turn the system into an acute care system, not a chronic care system. And as a result, the only way that you can truly get the care that you need if you have a chronic disease is to either follow the model that Daisy was just advocating for, which is to become an educated patient, or to step out of the system and work with people who are not working within the traditional system. If you don't take one approach or the other, I think you're right. It isn't possible. You're not going to get better because this is purely an acute care system. Give me your reaction to that.
Yeah, I think it's changing, but in general, people didn't want to spend, they don't think they should spend money on healthcare. And, you know, I have insurance and I get it. You have insurance, but what does it get you? And unless it's cosmetic. But, you know, I was really into healthcare reform and put together, you know, whole healthcare reform thing, did a lot of interviews, and US News and World Report accepted it for publication, but then edited it and everything, and then pulled it the last 10 minutes. And then I was trying to get a letter to someone in Congress or something. I ended up getting to Paul Ryan, and they have me sign a thing that I won't quote him. And then he sends me back a letter. Well, I read your proposal and it's very interesting, but it would never happen because do you know how many people are slurping off the trough of healthcare? You know?
Well, you know, so the argument that we've heard from some of the folks in our community is that we need to move closer to a system like the British system or the Israeli system, or, you know, some of these other systems. And or the Canadian system, what we found is when we've interviewed people from Israel, and we've interviewed people from the UK, and we've interviewed people from Canada and Australia, that the system is actually worse, that the people who have Lyme disease who are in some of these, you know, these government run programs have to step out of the system even more quickly than we have to in the US, because the managed care that's available in those public systems is even worse than what we have here. And the only way that you're going to get treatment is stepping out of the system. So it's not to move further towards you know, these government run programs, but it's actually to become either a more,
if you break a leg or something simple, but if you have complex illness, forget it. But it's interesting how we think we're the free market, you know, system, and things like people like Sweden are socialist. It's actually the opposite. We are the least free market. Tell me how you can negotiate a price of your med, how you can negotiate the price of your care. These, like Sweden, they offer universal care, but you have co-pays. You have all these decisions. You're involved with, hey, I want this drug. You can get it, but you have to pay, you know, more. And we have no such incentives anymore. Like my brother's on Medi-Cal. I go and picked up some of his meds, and I had like trazodone. I was taken for sleep for a while. Like mine was like $47. His was $0. You know, and he takes the ambulance as an Uber.
Yeah. Yeah, you know, because I grew up in a country actually that is, I think, successful, the most successful when it comes to socialized or, you know, nationalized health, which is France. But not for the types of illnesses that we're talking about.
chronic illnesses.
So
right?
my sister, you know,
They have more free market system inside of that.
correct, they do more than any other country. You know, having lived in London, having lived in Italy,
And you have to pay for your insurance.
the not as good, but in France there is, and my sister and my mom, you know, both had cancer, and it's really, they handle cancer patients incredibly well in France, I have to say, 100% covered. But the Lyme care is, you know, it doesn't exist. You know, it's, people are forgotten once again, and you know, Dr. Klinghardt, who's also a good collaborator and peer, and wonderful person that we both work with. We've both worked with, and he'll say every day, like, medicine is broken, it's broken, it's broken, and it is. It's really very broken, and it's more broken today than it's ever been. So
It's getting worse.
Yeah, and it's getting worse. So it's very difficult. This is a really difficult topic.
Yeah, so we started a program where treating vets for free, and the first vet, they tend to be special forces. This guy was a combat controller, and he basically had traumatic brain injury, PTSD. He had a rod in his leg, and he had allodynia, which is you can't even touch the skin. It's just so painful, like a sheet on it, which I had for a while, which I thought, someone with that, you're like, crazy, but man, it's horrible.
Very painful.
And then the first visit, we got rid of his allodynia, and he couldn't even read a book, by the way. They found him, I'm kind of all over the place, but they found him face down with no pulse, and the heart failure, kidney failure. They put him in an induced coma, said he's probably not going to make it. So he had been for like 8 years in and out of the VA system and all that. So I don't think they came to us somehow, but it's like we started to say we won't charge anything. Again, by the first day, his allergy, he couldn't flex his foot, and he's just flexing it. And then another colleague like slaps his leg, and his mom and me, I was like, "What are you doing?" And it didn't hurt, And then by the second visit, he was so much better. He could read a book from cover to cover, anxiety much less. He went on a camping trip, and being special forces, a camping trip, no sleeping bag, and just turned his life around. And so then someone heard about this, and then a director heard about it and said, "I want to do a documentary on this." And then he ended up getting funding for a 12-part series and distribution on, like, I don't know, he names them all off, but like Hulu, Amazon Prime, blah, 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 Netflix. No, not Netflix, I don't think yet, but and so we're working on that right now and treating all these vets, and they're treated horribly. And I went to a party, and this guy was a vet, and he's getting divorced, which is so common. And then he says, "Oh yeah, the VA says nothing's wrong with me." And I'm like, "Tell me your little bit of history, just very short." And I said, "Let me guess, you got that." And he starts crying. How do you know that? And I said, "That's what they all have." He goes, how do you know? The VA says it doesn't, that my symptoms, they've never seen it before. I'm like, oh my God, And this is what we find, though. I said, "Come in. We're not gonna charge you." They don't come in, And I don't know if it's just like, "Hey, I want to tough it out," or not trusting her, or I don't know. But we're in the interesting thing is we're finding all these things are basically have the same common underlying pathophysiology. Immune modulation is huge, and mitochondria, and immunosenescence, and all these things. And like what you found with COVID, like 40% of COVID, especially post-COVID patients, have PTSD. And it just affects it a little differently.
Or they have brain fog, severe long COVID,
and but that's not considered associated with it. It's like.
So, Dr. Holtorf, one of the things that we deal with regularly on this podcast is the frustration that patients have with the time it takes to be diagnosed with Lyme disease. And there are a lot of different theories about why it takes so long.
Like 10 minutes.
I'm sorry?
10 minutes.
Well, yeah, well, and it didn't take you 10 minutes to diagnose yourself, which is sort of, I think, an important part of what we have to look at here.
Oh, yeah, it's like, and you go and you have a respected doctor, they go, or to show you, we had one very high-powered CEO in Orange County. I diagnosed with Lyme, he's doing much better. He goes to his doctor says, this is ridiculous, this is malpractice, there's no Lyme in California. And so he's calling, just panic, well, what are you treating me with? You're feeling better. I know, but it's not that. And he said there isn't any Lyme. He was adamant. And then about 2 weeks later, his dog gets totally sick, brings him to the vet, and the vet says he's got Lyme disease. And
so there is this political overlay that makes it challenging to diagnose it with Lyme. But I want to explore something else with you, right? Because you were sick, right? You were sick for a long time. In fact, you were sick for your entire life. And despite being a brilliant man who graduated from some of the top schools in the country, who certainly wanted to make himself better, you weren't able to diagnose yourself. And how much of that was based on the failure of the educational system to give you the tools that you needed to properly diagnose yourself with Lyme disease?
Oh, exactly. Because being evidence-based, you go, but here's the standard. Do this 2-tiered test. And if you're negative, well, that's not it. And there's really no chronic Lyme. And you're just told all these false statements, to put it nicely. And so you don't think about it. But then as you get more and more and start reading more and more, and there's, and Infectious Disease Society of America still doesn't agree there's chronic Lyme. There's post-Lyme syndrome. Well, what about all these studies that, they look and they find active, Lyme in the body when they have post-Lyme syndrome? Or, McDonald, who was head of the Harvard Brain Bank, biopsied tons of Alzheimer's patients and found, basically Lyme disease in the majority of them. They wouldn't let him publish it because it would cause too much panic. And everything's so political. And I think everyone's scared to lose their job because he would have probably been gone, and
But the political overlay is certainly a significant issue, and we should explore that a little bit together. But that wasn't an issue for you. You were not politically limited in evaluating your own symptoms. You weren't afraid to evaluate yourself to get to a proper diagnosis. You simply couldn't think outside of the box because you were educated in a way that boxed you in. And because you were in that box, you couldn't diagnose yourself, which makes it that much more difficult for well-intentioned doctors to diagnose third parties. I mean, if they just can't think outside of that box to diagnose themselves, how are you going to diagnose patients who are you're certainly never going to know as well as you know yourself, and you're certainly never going to know as well.
And plus, they're relieved when they turn up negative. Now they don't have to do anything. But yeah, and so with me, it's kind of like, well, wait a minute, I was told this. And you want to believe it, and you believe it. I'm evidence-based. I'm not gonna. And then all of a sudden, you see more evidence. Someone says something, and you're like, "Well, that's not what I was taught." And then you go do the research, and you're like, "Damn, wait a minute, that guy was more than right." And you find this, and even old research, and that really, I think you can basically for 2 months. Go to the old research and be a better specialist than the specialist, not surgery, but like gastroenterology. I mean, they're just scoping people. That's where the money is. Like they just discovered probiotics as gastroenterologists, endocrinologists. If you have an endocrine problem, try to get your endocrinologist to help you. They're diabetes doctors that give insulin. OBs, and I'm not trying to be disparaging, but they give birth control pills. They're supposed to be hormone experts. They take out body parts. And we have found hiring doctors over the last, 15, 20 years that I'm depressed because more and more doctors, like, I don't like protocols. Doctors love protocols, patients love protocols. And we got to do more of them, but I'm not a protocol guy. But that they don't understand, doctors don't understand concepts. They're taught, and maybe that's how, they're great book learners, great test takers, is they want to memorize and give me an algorithm. But that's also how they work, because you have to go through an algorithm, or if you screw it up, you're going to get brought in front of the board of the hospital. Insurance is going to cover it, da da da. So they're made to think like that, and it's their livelihood. If they switch, they're gonna, get less money.
But there's also this balance of working with generally accepted medical practices, and then knowing when you're supposed to determine whether or not your client, or I'm sorry, your patient is someone who is outside of the bell-shaped curve, is somebody who is
I think they're inside the bell-shaped curve that has been misdiagnosed for years.
okay.
And
But when you're a clinician, aren't you supposed to be using generally accepted medical practices? And then if you find that you have an outlier, then you should have the freedom to work with somebody who's an outlier. And I guess we can define outliers in different ways, but an outlier
we work with is an outlier.
Okay.
I don't think they're an outlier, really.
Well, they're within the bell curve, they're an outlier. They don't fit. I mean, I haven't had a single
so many people
client
like them, but they just don't deny it. And it's like, and they have the problem is they go to their doctor and says, oh no, that's ridiculous.
Not just their doctors, they go back to their family.
Oh, and their family and say, oh, this
When
black
their
doctor.
families
Who is
are like,
he?
have to undo all of the conversations and education. I mean, as an advocate, my job is to educate the family so that the patient, the client can get some peace in relationship to their treatment protocol or to their, course of treatment ahead, because they're going to be doubted so much that then they're going to continually doubt
and they're
themselves.
going to break, and they're saying they're spending, money. And so that gets resentful. And once you speak to so many patients, I've been to the best doctors, it's chief of staff over here. People always go, I'm going to the Mayo Clinic. I'm like, see you.
Well, so you cited the work of Dr. Alan McDonald, who's one of our favorite doctors. We've interviewed him several times. And one of the things that Dr. McDonald's argued is that we need a divorce from Lyme. And his argument is that by using this term Lyme disease, we're putting ourselves in a position where we have a disease without a definition. And because we have a disease without a definition, we start to have some challenges of even defining the problem. And one of the things that I was thinking of when
I think we agree with that.
Yeah.
We'd like to rebrand Lyme.
And when I say Lyme disease, it's kind of like Lyme disease. What is it really? We may be treating something very different. And there's so many infections coming out that don't come up on blood tests, and
well, but you're not even testing for it, right? I mean, it's
right, I mean,
so let's say with this chronic Lyme versus the post-treatment Lyme syndrome divide, right? Isn't the real challenge that we don't have a definition for Lyme disease? I've had some doctors slap me across the hand and say, Richard, Lyme disease is Borrelia. And then I've had other doctors say to me, it's a polymicrobial infection, right? And so we have this multi-defined disease. And then couldn't we have someone who actually has chronic Lyme disease where they have active infections, but it's not the one infection they're looking for? And because it's not the one infection that they're looking for, now they're arguing that you have post-treatment Lyme syndrome rather than chronic Lyme disease. And aren't we in some cases really just looking at the same thing differently and defining it differently because we don't have a consistent definition?
It's a semantic war.
That's what I was going to say.
It's not, it doesn't make any sense. Yeah.
And it doesn't matter what you call it. And we we often won't even check for infections. We'll check the immune system, other markers. Then because a lot of people won't do the test. They, I don't have that, I don't have that.
CD57.
But you want to get the activity. But
yes.
But anyways, and then show them this is screwed up, and they'll say, everything's been normal. You know, what does your doctor check? The CBC, a chem panel, cholesterol, and they go, oh, your cholesterol's high.
And
You give
just
them
the TSH,
and give them a statin, and they think, oh, my cholesterol's so low, which you just increase the mortality of that person, increase their risk for heart failure, increase their risk for,
Yeah, I mean, we look at this great guy,
Alzheimer's.
you know, Dr. Daniel Goodenow, who does, I don't know if you know about prodrome science, and, you know, he does this amazing, he wrote this amazing book on Alzheimer's disease, and, you know, how plasmalogens essentially prevent all of these neurological conditions. And so he does this very interesting panel, and, you know, he looks at people's, you know, everything in term, and he also looks at people's cholesterol levels, and anything that's below 200 cholesterol, they're at risk for neurological diseases, for cancer.
You'd be
And
surprised.
all these doctors
Consistent.
and then everybody's putting these people on statins because they're 205 or 210, you know, and then they're dropping to 150, and then we tell them your cholesterol's too low, and they think we're crazy.
Well, to show you, there was, you know, one study that showed, they looked at people's cholesterol levels, you know, cholesterol, HDL, LDL, the other things, and fibrinogen. And if you had low fibrinogen, low risk for heart disease, didn't matter how high your cholesterol was, high fibrinogen, you know, high risk, no matter what your cholesterol level was. So aren't we testing the wrong thing? You know, but there's a lot of money to be made in cholesterol, and it makes sense. See, people get it like, oh, the you know, the lipids, you know, basically collect on the vascular wall. That's not what happens, you know.
And they focus on the wrong thing, you know. I mean, we're gonna get into a whole nutritional conversation, but you know, they're being told to be, you know, to stop eating meat, to stop eating, you know, that everybody has to be vegan now. We all eat bugs because, you know,
next week it's going to be different.
And you know, and nobody's allowed to eat, you know, grass-fed butter anymore because, you know, you're going to die the high cholesterol. You should eat bugs. You should eat Impossible burgers, and you know, and then everybody's eating, you know, industrial seed oils, and you know, so it's just
I think it's a nice transition to the last thing that I'd like to talk with you folks about. And you've been really, really kind with your time, and we're going to give you the opportunity to wind down. But there is one really important topic area that I'd like to explore with the two of you, and that is you know, the risk of Lyme disease, right? General Stanley McChrystal, in his brilliant book Risk, defined risk as threat times vulnerability. And it's one of the formulas that I've been spending a lot of time thinking about and using during the course of this podcast, where we have somewhere in the neighborhood of 500,000 people per year being diagnosed with Lyme disease. And we have in excess of 2 million people suffering currently in the US with chronic Lyme. It's probably higher, but at least diagnosed with chronic Lyme disease. And we've seen some recent studies that are showing that at least 1 in every 15 people in the world has Lyme disease, right? So we're seeing these numbers explode. So let's first talk about
the definition, like you were saying, that now how many people have it?
Right, and on a very narrow definition, of course, you're right, certainly in the 1 in 15 study, right, worldwide, right? So let's first talk about the threat piece of this, and then we'll talk about the vulnerability piece of this. So first of all, the threat piece is we are more likely to come in contact with Lyme disease today than ever before. And we were debating a little about this offline, about how what is causing this increased threat in this risk formula. And you know, one of the things that we focus on in this podcast in the past is, of course, because of global warming, the breeding window for ticks is extended, and as a result of the breeding window being expanded, there are just simply more ticks.
I'm not a big proponent of that. I mean, I think it plays a part, but I think there's other things that play a much bigger part.
Well, so let's get to that, right? So I think it is clear, and I think the entomologists are certainly been able to prove with evidence-based research that there are more ticks, and there has been an expanded environment that is that is
And that's what-
hospitable to ticks, both north and south, than there had been before. So there are certainly more ticks. But let's talk about some of the other things that we were talking about offline, where you believe our exposure to Lyme disease is greater today than ever before.
Yes, and I do think it has to do with, with the extended number of ticks are invading, but that's really pushed highly because it's the thing, global warming. I'm more worried about toxins than
Okay, but isn't that really a vulnerability issue?
Yeah, that might be a vulnerability issue, but
Let's focus on the threat, meaning the likelihood of us coming in contact with the polymicrobial disease first. And I do want to talk about vulnerability, but let's talk about threat.
So we have to go back to, determine once again a semantics conversation, and we have to talk about tick-borne versus vector-borne, which is what we were talking about before, and how many vectors into the body are there. So, the only other really well-known, and I'm not going to only talk about Borrelia, but the only other really well-known spirochete is, syphilis. And so, syphilis is known to be sexually transmittable. And, there is no definitive or really, nobody's fully stating that Lyme disease or Borrelia, and I mean, we've already talked about the difference between Borrelia and Lyme disease, so I'm going to leave that alone. But nobody's really saying, outright that Lyme disease is sexually communicable. I think Lyme disease is sexually communicable. And if that's the case, that's a very well-known vector, potentially a more threatening vector than tick-borne.
Well,
Also,
I don't think it's fair to say no one is saying that. I can tell you, Dr. Alan McDonald has.
Alan McDonald, yes, I apologize, and you're absolutely right.
What did you say? What?
So I made an incorrect statement, and that is that the statement that I made is no one is coming out and saying that Lyme disease is sexually transmissible, because it's being said kind of more quietly in our inner circles. But the world at large, because the world at large, patients, clients, young people who are having sex and who are not necessarily using any kind of other protection because because in some ways HIV or other STIs don't seem threatening to them, are getting tick-borne infections, let's call vector-borne infections from having sex. It is happening.
So there's certainly some research that is suggesting that in the vaginal fluids and the sperm tests that have been done with one partner or the other who has been diagnosed with Lyme disease, it's very, very highly likely that when they're testing the fluids of the other partner is testing positive.
But have you noticed that they haven't followed up with those studies and see what the real transmission rate is? They don't want to know.
Right. So, and that's where we're splitting hairs. Like, that's why I said no one, and I was wrong to say that. You're absolutely right to call me out on that.
But Daisy, there is some debate about that, right? So, for example, Dr. Fallon had argued that, when he looked at that study, that the reason why both the male and the female partner were in that study were both likely to have the bacteria, the Lyme bacteria, Borrelia in their fluids, is because they're living in tick endemic communities and they're likely to both have been bitten by ticks. Is that right? Is it wrong? I don't know, but it is certainly one of the things that we have to consider from vulnerability.
What about two young people who hook up for 10 months and have never been in any kind of tick.
Both myself and my girlfriend or wife to be have Lyme disease. I blame her that she gave it to me, then she blames me. Well, that's kind of weird. We're in a state that doesn't have Lyme.
Wow.
But I think too, kind of with this in utero, is that I think a lot more people had it, but now with all the other environmental things, it's coming out much more.
Okay, so let's get to vulnerability. I mean, I think there was a fourth prong that we talked about that I'd like to just touch on, which is blood transfusions, right? At least here in New York, you have to fill out a questionnaire about whether or not you have been diagnosed with a tick-borne illness before you can donate blood. I understand that's not something that's national, but here in New York, we have to do
Yeah,
that.
but they're gonna say no, you know? And because the
they
doctor
know?
told them they don't have it, even if they have symptoms, and they very well may be asymptomatic. And it's
But at
like-
least we're asking here in New York, right? I mean, at least the questions being asked so that people who have been diagnosed can check the box and not be donating.
Or if you
Obviously,
ask,
if people
like,
have
for-
not been given a diagnosis, that's not going to help.
yeah, for like risk, have you had any homosexual interactions? I mean, basically people saying no when they have is huge, and so I think, that's a start, but like, and they don't like Babesia in the blood. They weren't even checking for it. The tests are terrible. Now, what about the spike protein on all the blood? Now our blood's totally contaminated, but.
So let's get to vulnerability because I know you're excited to talk about that. So why are we more?
Can I just add before we move to that in terms of the vertical transmission in utero, basically, I've worked with a lot of different OBs. Now there are Lyme literate OBs and there are not Lyme literate OBs. And I've worked with clients that are pregnant and have positive IGeneX, IgM, IgG variant, and the OBs don't have, and a Lyme literate doctor might say, you and I dealt with this before, hey, you're pregnant, would be probably a good idea to protect the offspring to be on antibiotics throughout the pregnancy. Well, the OBs will say that it's dangerous, they can't do it, it's not okay, don't do it. These are things we encounter on a regular basis.
Yeah, or you think a threat, like, okay, our family, we weren't campers, like we hated the outdoors, we're in California. What was our threat? And everyone had it.
Well, because 70% of the people who contract Lyme disease get it in their own backyard, right? The bias is that you have to be an outdoorsy person, or you have to be a camper, or you have to be a hunter, and that's simply not true. The overwhelming majority of people who have come in contact with ticks in their backyard. And I've shared with people on this podcast that I've been bitten by a tick every year for the last 5 years, at least one that I've discovered biting me, all of which came from my backyard, or one of my dogs that came in the house from our backyard and sat on me.
If we're California, where they're
And
saying
cats.
there is no Lyme disease.
Well, but we know that's not true, right? We know
Cats,
that there is Lyme disease
fleas,
everywhere.
Bartonella flea, okay.
Like cats, mosquitoes,
Well, again,
Recluse.
so let's talk about vulnerability now, right? Because this is another piece of it, right? Because we do know that humans have been coming in contact with the Lyme bacteria, at least again, Borrelia, for as long as there have been humans. Dr. Bill, for example. What's that?
The Iceman that they found.
Right. So we know actually the Iceman, who was 5,300 years old, had Lyme disease, but it actually predates Etsy the Iceman. So which suggests that because humans have been coming in contact with this bacteria for as long as we have been, we do have immune defenses to it, right? On the virility scale, it's pretty low, and we should be able to protect ourselves at least against this one bacteria. I think it changes when we are looking at a polymicrobial disease, which let's put that aside for now. But as it relates to the vulnerability, we are more vulnerable today than we've ever been before. Some of it is lifestyle, some of it is diet. I mean, we have all this. So let's build that out together. Why are we more vulnerable to this, suffering from a chronic disease that traditionally we've had the ability to manage as part of our microbiome?
My thought again is, I think stress and the levels are just out of control right now. All the toxins, and it ends up lowering immunity, and that's what it comes out. So I think most people that get Lyme never have symptoms, especially years ago. Because they have good immune systems and all that. and only in the vaccine debate, but it's like we check natural killer cell function and people got vaccinated. Every time they got vaccinated, it went lower and lower. And now they're finding, like the derms are saying, huge melanomas in young people, the OBs, like weird cancers, cervical cancers. It's a problem. And we're big on the immune system, immune dysfunction. We figure when we fix that, many of these things fix themselves.
Yeah, I mean, I think it's really interesting what you're saying, and I've been thinking about this more and more, and I've been working with a number of practitioners. Right now, there's so much going on in terms of, circadian rhythm health, circadian rhythm dysfunction, and deuterium depletion. And if you listen to Stephanie Seneff and you listen to James Lech, and there's, I'm currently doing a course with the Dutch University, and I work with another wonderful ND by the name of Petra Dorsman, and their conversations are very much about, how are we depleting deuterium, and how are we no longer denaturing ourselves in human, form in our humanity. And unfortunately, we're living in a culture, where there is just so much focus and emphasis on denaturing ourselves more and more. And, getting back to, sunlight, everybody's, covering themselves with toxins so they don't get any sun, and there's all this, propaganda about how, healthy food is not healthy and all this stuff. So we are becoming denatured and we are becoming more toxic. And we know because when we see people who have high levels of heavy metals, glyphosate, we see all of this, they have much higher levels of bacteria, and these things polarize to each other.
And then you got the, microbiome, of course, and
all of this stuff.
And
And then, patients in general, like, well, I don't want to deal with this detoxing thing. I just treat my infections. We're like, we can't actually treat your infections if we don't treat your toxin load, because you'll never actually unravel this Rubik's Cube that you have put together, by being on this planet for 35 years. And this is a concept that's very difficult to help people understand. So with cancer patients, more and more deuterium depletion could actually be one of the most and only treatment course that you go through for long term, where you could eradicate cancer fully.
And there's so many things like that, and they're all, obviously, basically multifactorial. And you look at something like that no one's really heard about and how important it is, then you got 1,000 things like that. And it's just adding up, one more, one more thing. Or it's like we treat ALS, and we've had ALS patients come in wheelchairs, they're jogging. And they go back to the neurologist and they go, oh, it must have been a misdiagnosis or a miracle, I haven't seen one who hasn't had Lyme.
Or who hasn't had a high level of toxicity.
So Dr. Holtorf, I'm going to ask you one final question. You've been very, very generous, both you and Daisy, with all of your expertise and your brilliance. But I'd like to talk to you about the HPA axis. I know you know a great deal about the HPA axis, and you've written a great deal on it. Can you give us your thoughts on the impact that stress is having on the HPA axis, and the impact that stress is having first on cortisol receptors, the impact that the stress is having on the adrenaline, and what impact that's having on our ability to heal when we are managing the Lyme, the polymicrobial disease that we call Lyme disease.
Good question. So I did a review a while ago now, HP axis dysfunction and chronic fatigue syndrome fibromyalgia. Looked at all the research and found that when they did appropriate testing, like the central test that would stimulate and but the standard ACH stimulation test is ridiculous. It's like hitting someone with a hammer and going, do you have pain? But found that the overwhelming majority, 90%, had HPA axis dysfunction with chronic fatigue fibromyalgia. When we found that the fibromyalgia patients had more hypothalamic dysfunction, and the chronic fatigue syndrome patients had more pituitary dysfunction. Makes sense of the pain center and stuff there. But it is a problem. I think sometimes maybe a little too much emphasis, because it's all the hormones, and it's, you know, it's pineal, hypothalamic, pituitary, then all these hormone dysfunctions, including, you know, thyroid, low thyroid with low TSH and high T4, which everyone says, oh, that's high thyroid. You know, that's what depressed patients, that they'll have low normal TSH, high normal T4. And the doctor's like, see, they're hyperthyroid. Then they give them T4, say, see, it didn't help. It wasn't hypothyroidism. Well, let's look at the STAR report. Largest study ever done on antidepressants showed that T3 was a better antidepressant, regardless of their levels, than antidepressants. Another study, 135 treatment-resistant bipolar patients. They tried on average 14 different medications with no response. They gave them high-dose T3, didn't matter what their levels were. 80+% responded, and I think it was 25 or 30% total resolution of symptoms. You know, and now, and with the adrenals, we have found that we don't do a lot of specialized, but we found, because if you give like epitalin and pineal peptides, that it's interesting, like with a rat, you can even, they took out their pituitary gland, gave them epitalin, and their thyroid levels normalized. You know, so, and that kind of fixes itself. And, but if you see also, let's say someone has, with stress, high ACTH, the body's pumping out corticotropin releasing hormone. And you'll see patients with a high ACTH but a low cortisol. And what that tells you is they have high CRH, which is a huge stimulator of mast cell. And so it kind of goes around and around. So we find if you have that, you want to give them a little cortisol to lower that until you can get things under control. But yeah, adrenal, and people think cortisol is bad, but it really helps you deal with stress. Like if you have, and it depends, if you're totally relaxed and in good health, you can have low cortisol and be fine. If you're in the ICU and you have a normal cortisol level, you're going to die, you know. And, but I think it's just kind of also the stress patterns, the sleep patterns, we've screwed it up, and you get basically a flat line, you know, or you get peaks at the wrong time. But that we find, I think peptides are great for kind of fixing those. But we'll use a little cortisol here and there, and adrenal, you know, supplements and things like that. In fact, I think the adrenal supports are #1 product. So obviously it's an issue. People wouldn't buy if they didn't keep buying if they didn't feel better. So I think it's an issue. It's also kind of about testing. You know, we'll just do a morning cortisol. The Brazilian Journal of Infectious Disease showed that if a person who has a chronic infection has a morning cortisol less than 12, there's like an 87% chance that they have adrenal dysfunction. And so we'll look at that. Some occasionally we'll do, you know, like the saliva, so you can do it multiple times and see what it is. But I find, you know, I don't want to get in that debate because every test has its pluses and minuses, you know. But we'll use it when we need it. I think it can send people astray sometimes. Yeah, I think it's an issue, but it's like people will put, so like adrenal fatigue, which you know, you'll hear kind of, I'm nothing against chiropractic, they'll use it a lot. So it got a bad name of just like kind of quackery. And I was supposed to do a debate in the Journal of Endocrinology about, is there adrenal fatigue? But I really blew it by giving all this information up front. And they're like, whoa, wait. this is too pro, and he has too much fat, too many facts, I think. So then they're like, no, we'll get someone else. It's an issue, as are all the hormones. And I mean, that's the thing. It's a multi-system illness. And the more we learn, the more we realize we don't know, you know.
Right. And it's dangerous to segregate a system and focus on a system when it's a polymicrobial disease that's going to affect many systems in different ways in different people. And that's, of course, one of the challenges of Lyme. So let me ask you the final question so I can let you two folks go after, again, being so kind with all of your information and experience. So Dr. Holtorf, if at the end of this podcast on the way home, when Daisy's driving you home, you discover that she has a tick biting her, what would you recommend that she do so she wouldn't have to go on a chronic Lyme disease journey?
Well, you remove it as soon as you can. And then I would almost always treat with triple antibiotics and for extended period of time, because I think it's kind of that risk threat thing that, okay, well, what's the risk of taking antibiotics versus if you get chronic Lyme, you're not happy, you know? So I am on the side of aggressive treatment. And I know that that's another very controversial area.
So what if you were to diagnose, if you were to recommend the, you said triple antibiotics, would there be any other recommendations you would make for folks who would be taking those antibiotics to offset the impact that it, for example, may have on the person's gut health?
Oh, yeah, you got an hour, you know, so yeah, it's when I say things that doesn't mean we're not doing a ton of other things. It'd be, you know, peptides to immune modulate, mitochondrial boosters like ozone, yeah, probiotics, IgG orally, yeah, maybe
stem cells.
Yeah, stem cells. I mean, all these things. So it's very individualized because, you know, I wish I could give everything to everyone, but you know, that's not practical. But yeah, always not just take this. And we find, like, for instance, when we do use antibiotics now, that we can give much lower doses, like for a shorter period of time. And because if you have no immune system, you're going to have to take this for 5 years or whatever. But maybe 3 months would be fine, you know, when you get everything else working. But very good question. And yeah, almost always we're doing a lot of stuff, and we're trying to get that plasmapheresis machine, which I love. And yeah, and so what was in there, and the doctor's like, this is heavy metals. It was a lot. And then these are, you know, organic toxins, and these are immune complexes. I'm like, holy crap, you know, it's so much. And that was just, you know, one and then another treatment. So we're just loaded with this stuff.
All right. So Dr. Holtorf, can you please just share with our folks as we wind down where they could get in touch with you if they wanted to work with you first in your medical practice? And I'd like you to talk a little bit about your I don't know if it's a pharmaceutical company or a supplement company. I'd like you to define that as well, because I think you've done some great work on both prongs. So first, give the names of your companies, and then how folks could access the resources.
So our main clinic is Holtorf Medical Group, holtorfmed.com in El Segundo. You know, we kind of treat everything that if a doctor can't figure out, we'll treat it. We also do, you know, typical, you know, it's funny how many people's lives we change with just giving a little thyroid, or even Lyme patients who've been struggling, we've seen the best doctors, and like, you know, your thyroid's really low, and they're like, oh my God, that was it, you know. But so we treat a lot of stuff. We're basically an immune modulatory clinic. We love peptides, and that's, you know, kind of from my story. Love ozone. We use, you know, a lot of supplements as well. You know, different medications. We're kind of getting into which transfers over to chronic illness, is the longevity biohacking group, stem cells, what else do we do? I forget half the stuff all the time, but and that's a problem too. Like 85% of our patients don't know 85% of stuff we do, and they'll go, oh, I just got this treatment. Oh yeah, we've had that for 15 years, and then we really being into peptides is just seeing the huge benefit, and then using on patients, seeing the huge benefit. And we had originally 32 centers around the country with the fibro and fatigue centers, but that was my first taste of corporate medicine. And so it was a guy who was an entrepreneur in the medical space. He had terrible fibromyalgia and went to all the experts he could find, just treated like crap, to be honest. Like, he flies out to one place and the doctor won't come out of the room because he didn't get his check. And he's like, it's right there. Well, no, we didn't in the FedEx thing. No, we didn't cash it, so it doesn't count. I mean, just the cruelty. But he came out to our center, and within a visit and then 2 visits, he was dramatically better and said, we need to bring this to the rest of the world. And so said, oh, this is great. Let's open all these centers. I learned that I hate managing, other doctors, and it's a pain. But then they got funding, and then which came with that is a board, and they'd be saying these things like, I'm like, dude, this is not, Target. This is a medical practice. I mean, they're just like, you don't have a Harvard MBA, you're just a doctor, like, yeah. And so I ended up leaving. I trained Dr. Teitelbaum to take over. And then the board fired the 2 people I started it with. And within 6 months, they were out of business, But we thought we found the fatal flaw, because the problem is you have corporate centers, you have a doctors working, and they, it's hard work. And people say, oh, you're in it for the money. If you're in it for the money, you don't want to be treating Lyme.
No.
There's a lot easier ways to make money.
Much easier.
But so the doctors will kind of go, and then it takes a year to train a minimum. Trying to train them, you got to shut down the center. So we did, let's make franchises where they got a piece, they have an incentive to stay around. But I found even with an incentive, they don't listen, and they pay their franchise fee, but then they're like, no, I don't want to do that. Like, you're paying for the advice. So anyways, we let most of them go. Some bought out, some we said bye. We have 1 left in Atlanta, so we're kind of, I may join Forum Health as kind of a whatever C-level thing, and overseeing the clinical part. And they're really into, I wouldn't have to manage. I'm a terrible manager. I am too nice. It drives me crazy. And when I kind of had to step back from patients to become a manager, you think, well, okay, I'm moving up. I hate this. I want to see patients, But how many patients can I see? So kind of for the greater good, and that's what they're into, is the greater good, which so we're really jiving with them. So that may happen soon, and we're starting a training program for doctors, and then she's going to run the one for health coaches and advocates. So that's starting in hopefully February. We have the integrated peptides, which is a supplement peptide company. So people can get it on their own. We want them to go through their doctor. Their doctor can get them a better deal. So kind of an incentive to go see a doctor, and chiropractors can use it. I mean, they're just exceedingly safe, which is nice. And so we've been doing that. That's been going well. We just keep running out of product is the problem. Mm-hmm. And then we kind of have I wish I would have built it up more over the years, but the goal was with the National Academy of Hypothyroidism was to basically train doctors and sophisticated patients on the way we practice medicine, in this practice thyroid treatment and diagnosis and treatment is wrong. And you know, a couple of review articles that have 500 references, but they're still TSH, 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 you know, and it's probably the worst tissue to look at, you know, unless you're totally healthy, have no stress, no toxins, no chronic infections. But other than that, it's a bad thing to look at. Started a biopharm company for all my sins, but to do clinical trials and all these things. But we're always doing kind of, you know, pseudo clinical trials that are very safe. And I love coming up with new compounds. And of course, I take as much as I can to like, and do the toxicity studies right there, but they're shown to be safe anyways. But and I like doing that. I love research and you know, developing things, but also love seeing patients. But it's like, you know, how many...
Only so many hours in a day, but it is wonderful that you're doing as much work as you're doing. And I can't thank you enough for spending so much time with us. And we're really excited that you and Daisy are going to be working together on a training program. That's something we've been encouraging Daisy to think about as well. So it's wonderful that you're going to be working together on that. So again, thank you so much for spending time with us here at Tick Boot Camp. And I know the folks in our community are really going to be blessed when they have an opportunity to hear all the wonderful things that the two of you shared with us. So thank you and good night.
Keep your eye out for the documentary coming out. And we'll send you some clips. And I'd love to kind of get together with you and learn more about your organization and see how we can collaborate. And I've learned that, you know, I first started like, I don't want to tell people what I do, and they're going to be a competitor. Ridiculous. I mean, you can't even spoon feed them. And so I think collaboration is the way to go. And you know, helping each other, we can just reach so many more people. Love your style and
Thank you so
what you're
much
doing.
for
So it's been an honor
spending all this time with us tonight.
Yes, thank you. I appreciate both of you, and you're really doing God's work, and thank you for continuing to bless everyone. So we'll thank you and wish you well.
Thank you. You too.
Thank you for listening to our Tick Bootcamp interview with our guest, Dr. Kent Holtorf. To our listeners, we have a call to action. First, if you'd like to learn more about Dr. Holtorf, check out his websites at holtorfmed.com and drkentholtorf.com. Second, if you've enjoyed this episode of our Tick Bootcamp podcast, please share it with your friends on social media. Third, Tick Bootcamp has created a Tick Bite blueprint that has been inspired by the information that has been shared with us by past podcast guests. We urge you to visit our website at tickbootcamp.com/bite to view the blueprint. Fourth, don't forget to subscribe to our podcast on Apple Podcasts, Google Podcasts, or Spotify to get your automatic episode updates of our Tick Bootcamp podcast. Please take a minute to leave us an honest review on your podcast platform of choice. And finally, if you'd like to search our podcast library of almost 350 episodes, subscribe to our email list, or share feedback with us, please visit our website at tickbootcamp.com. Thank you, as always, for listening.